Are there any, I mean, cases that you would consider, I don't want to use this word, but a nightmare case that kind of changed how you think about managing psoriasis now, that might have some gems in it for other practitioners?
Well, it was my palmoplantar one. She started to get oral lesions, and you can get oral lesions in psoriasis. It started getting red and bloody, and I'm like, okay.
Mhm.
And of course, it's in the evening. She comes in. I go, okay. So at that point, I'm like, we need to call out. We need to make sure that if this gets worse, we need to go to an ER, or we need to go to an ambulance. And of course, she didn't want to. So I was out there for a while. We had to do oral treatments. I called my friends who were oral surgeons at this point. We're trying to stop bleeding. We're trying to calm it down. And there are lesions. There are medications like oral paste and that is a cortisone that calms it down. There are spit and swallows that are made up of different combinations of lidocaine, tetracaine, doxycycline, calm her down because she was nervous to go. She eventually ceded and said, I'll go to the hospital. But those kind of cases come up, and she was very febrile. I'm like, you're sick, you're bleeding out of your mouth, you can't walk, you're just can't. She's like, but I don't want to leave. I want you to take care of me.
Mhm.
At that point, I said, well, we'll take care of each other. And I worked with the doctor, the hospitalist that was going in, but that was a nightmare. And in that case, it's kind of like it doesn't matter. You're not hurting your patient's feelings, not sending them to the hospital. You have to call an ambulance and they have to go in.
Wow. So to close out, if you had to give a dermatologist and other prescribers maybe two or three concrete changes to improve psoriasis diagnosis and treatment, um, maybe one at the exam level or the prescribing level, whatever sticks out to you, what would they be?
Don't judge a book by its cover. I hate to say, when in dermatology, skin presentation is everything, especially with pigmentation. Don't just automatically think that person has eczema. You have to really do an exam because you're going to lead to more scarring later. And don't be afraid to say you have psoriasis, or if you're not sure, do the biopsy. And pretty much also listen to your patients because your patients do have that history, and make sure that they don't things that exasperate it, drinking alcohol, certain medications. Look at their medications, like beta blockers, lithium, hormones, hormone replacements. And kids can get psoriasis too. History of strep throat, untreated especially, leads to psoriasis.
Wonderful. Well, this has been a great conversation, Dr. Honore. Thank you so much for joining us on MD Newsline.
Thank you for having me. This is always wonderful.